Hello, friends. Hello, friends. Let me introduce myself. I am Dr. Mohammad Zohur Bhatt, a PG scholar in Department of Shalya Tantra, TMAE Ayurvedic Medical College, Hospital, Karnataka, India. I am also proprietor of Dr. Zohur's Anorexia Clinic, which runs in J&K. India has been running for last 5 years or so. Uh, Today, my topic of discussion will be laxative addiction. Uh, we'll start with the causes, then we'll go to symptoms, treatment, and Ayurvedic prospectus in wherever it is needed. Let's go to our first slide. It's the introduction about the laxatives and the Ayurvedic prospectus as well. Laxatives are the medication or the substances that stimulate bowel movements and promote bowel regularity. Actually, it's for the patients who are suffering from constipation only. Laxatives are meant to be regulating the bowel movements. In Ayurveda, laxatives are known as Rechik Dravyas. Uh, there is also one therapy in Ayurveda called Virejan therapy, which involves the use of drugs, use of laxatives or purgatives to eliminate toxins from the body. While laxatives are useful for the patients who occasionally constipate, long term use of these laxatives can cause dependence, abuse, or addiction. So, the presentation we are doing today shall explore the causes, symptoms, and treatment options for laxative addiction. Next slide. Causes are highlighted here. Chronic constipation. Uh, this, of course, tends to be the primary cause why a patient wants to take laxatives. Then we have some eating disorders as well. Eating disorder means the patient tends to take untimely food, unregularized food, and whatever the eating habits, the wrong eating habits he has. Then we have irritable bowel syndrome. Irritable bowel syndrome has episodal constipation and loose motion. Patient has a history of stress-induced loose motions and stress-induced constipation, anxiety-induced. So it's mainly related to your psychological health actually. Then we are separately discussing that psychological factors as well. Then laxatives for weight loss purpose. This is very interesting and important prospectus of laxative addiction. We'll be discussing later in the slide. First of all, we will take this chronic constipation. Chronic constipation means infrequent bowel movements or difficult passage of stools that persist for several weeks or longer. That's chronic constipation actually. Before you, that infrequent bowel movements or a difficulty in passage of the stools that should be there for several weeks or longer, for months. Then only it can be called as chronic constipation. Generally, constipation is like if a patient is not defecating for at least he should defecate 3 times a week, uh, then it's okay, because some patients tend to go to washroom after 2 days. That's completely physiological. It cannot be brought under the banner of constipation. If it's fewer than 3 moments, then only we can say that that patient is suffering from constipation. Then occasional constipation is very common. Some dietary modifications and some lifestyle modifications can cause constipation in some people. Though occasional constipation is common, some people experience chronic constipation that can interfere with their ability to do their daily tasks. And chronic constipation may also cause people to strain excessively in order to have a bowel movement. This is the main reason of anorectal disorders, actually, like piles, that hemorrhoids or fissure in ano. The main reason is not actually constipation; it's actually straining. If the patient is constipating, he tends to strain in the washroom, and while defecating, he tends to strain a lot, so that His bowel is vacuated, but unfortunately he's not able to do that. So it tends to become the main cause of hemorrhoids or fissure in narrow. And treatment of the chronic constipation, it depends on the underlying cause actually. But if there are a lot of chances that you don't find a cause. uh, I have seen patients in my clinical practice, ranging from neonates to 75 years, who are suffering from constipation for longer durations, and there is no particular cause you can attribute to that constipation. In neonates, I have seen nothing like diverticulum, nothing like intersusception, no hypothyroidism, and still the patient is constipating, and it persists lifelong. And in adulthood, he tends to develop other anatomical disorders as well. And he's put on laxatives from very beginning, and then the tendency of becoming an laxative addict are more in those cases. Next slide. Eating irregularities. This is very common, very common in our modern day world and our lifestyle. Like we take low fiber diet. Actually, we don't know where the fiber is. Patients in my daily practice ask me this question: What is fiber and how can we take it? So fiber can be anything. Yeah, even a biscuit can be a fiber. Nowadays, biscuits with fibers are coming in the market, and you can take salads, you can take fiber-rich vegetables, fiber-rich fruits as well. Then taking very low quantity of fluid is also a cause of. Actually, these causes also, all of them you can see in the last, but all of them can cause constipation, which simultaneously results in a laxative addiction. So, taking low fiber diet, taking low fluid quantity, taking a lot of spicy food, eating junk food, and unregular, untimely food habits. Actually, this point is based on Ayurveda. In Ayurveda, advocates to take timely food. If you are taking breakfast at 7:30, it should be 7:30 every day. If you are taking lunch at 1:30, it should be 1:30 every day. If you are taking dinner at 8 p.m., it should be 8 p.m. every day. You cannot shuffle it. You cannot do random trials on your body. You need to be very disciplined. God has made you disciplined, your body disciplined, so you need to stick to it. And then taking ruksha or dry, what we call dry in modern terminologies, ruksha in Ayurveda. Ruksha means having low water quantities. It's a dry food. Sometimes some people do not want to take uh, foods or anything of that sort, which is liquid in nature or which is slimy in nature or which tends to be semi-solid in nature. People hate it. They try to take dry foods only, but that's not at all good for health. And for those people who are suffering from constipation, it's not at all recommended. Tikshna ahar again means mostly that spicy kind of food. If somebody is taking, you might have seen if somebody takes a lot of spicy food, he tends to take a lot of water. His mouth dries out and he wants to take a lot of fluid. Actually, the reason behind is that his gut demands a lot of fluid. If the gut is working properly, it demands a lot of fluid so that spicy food can be countered and that can be brought out of the gut as soon as possible. So all of these causes lead to a laxative addiction due to constipation only. Then we have irritable bowel syndrome. Actually, this is a disorder which is marked by irregular bowel movements in which a patient tends to pass stool frequently on food intake, followed by constipation, which may sometimes require mild laxative intake. Actually, not mild, it may require mild to moderate laxatives. Irritable bowel syndrome is like it goes on with the patient lifelong, and it's inevitable to manage it without the use of laxatives at times. At other times, it tends to remain smooth. It tends to the patient takes food and he wants to go to the washroom. Sometimes this happens. At other times, patient is constipating at severe type of constipation. Then we need to give laxatives. So Frequent use of these laxatives may put the patient in the category of these laxative addicts. Then we have psychological factors as well. Psychological factors like stress, anxiety, these factors can lead to disturbed gut movements, can cause incomplete bowel evacuation, which spontaneously forces the patient to take laxatives frequently. Actually, diseases like irritable bowel syndrome, gastritis, gastroesophageal reflux disorders, irritable bowel diseases, and other diseases like ulcerative colitis is a part of actually IBD, and solitary rectal ulcer syndrome, sometimes polyps, sometimes hemorrhoids. These all things are related to your GIT, and GIT is directly related to your emotional or psychological state. Psychological factors like anxiety, stress, and all these things. Uh, Irritable bowel syndrome is known to be related to your emotional state and your stress levels. So managing these stress levels is very important. And if a person or a patient is psychologically disturbed, he tends to develop this habit of constipation, and severe type of constipation can occur, and then he is asked to take laxatives, and patient he forgets that he has underlying psychological condition. He That laxative helps him in evacuating the bowel actually, and the patient forgets that there is an underlying psychological condition which needs to be treated actually, and that this delay in treating that psychological issue, the patient tends to become a laxative addict. This is a new thing now. Laxatives for weight loss. In recent times, we have seen that people are becoming more fitness conscious, and laxatives play an important role in managing the patient's weight. This may sound hilarious, but many coaches and dietitians tend to use mild to moderate and even high in purgatives to their clients in order to get rid of water weight very quickly, and thus making the patient to stick to a particular diet plan which includes mostly protein. uh, I have seen it's a first-hand experience of mine. I went to the gym, and coach and the dietitian asked me to take laxatives on the very first day. When I told them that I couldn't explain this. So actually, my gut is pittage, and even if I take warm milk with the intention of being a laxative with some sugar in it, so my gut responds, and I told them that there's no need of these laxatives, but they said no, you have to take a laxative. Actually, they are putting their clients on laxatives on purpose. If you put a patient on laxative who is not at all constipating, you are putting him on risk. You tend to put him on laxatives, and patient frequently goes to washroom and loses water. That's very important, and loses electrolytes, and he tends to drop down the weight very quickly. But that is only water weight, and after that the coaches and the dietitians, they put him on protein diet, mostly protein diet. There's a bit of carb and there's a bit of fat, but mostly the diet is protein rich. That protein rich diet, according to Ayurveda, that tends to dry out your intestine, and it can cause constipation, and you are becoming habitual. Now you are becoming habitual to those laxatives, and the coach asks you to increase the dosage of that laxative, because now protein is pushing you on the side of constipating people. So you need to see to it, if the coach is asking coach or that dietitian is asking to take laxatives unnecessarily, you are making a non-constipative person a constipative person. So protein-rich food tends to dry up the intestine and interfere with the flora of the gut as well, thereby causing constipation, and laxative intake becomes a necessity now. So this is very important in our in this scenario in present day world. Even after post COVID, the people are becoming very fitness conscious, and they are following advice of the people who are sitting at these centers, weight loss centers or gyms or aruba or yoga. So you need to see, you need to study, and do not fall prey for laxatives and then land into constipative people, and uh, obviously then you are a laxative addict. Ayurvedic and herbal laxative. I want to discuss this topic as well because Ayurvedic laxatives are considered safe and very effective as well. uh, and they are OTC available drugs now over the counter. They you can get any of the Ayurvedic laxative over the counter in most of the countries. The point to remember should be that these products are medical in nature, guided by Ayurvedic Pharmacopoeia of India, and thus are included in drug lists. You cannot go over the counter and take any laxative, be it Ayurvedic, be it some other pathy. Ayurvedic laxatives, they work in different ways, like causing bulk in the stool, like phycelium husk. Then they can cause breakdown of the stool in small parts. That's actually purgation. Bhedan, it's called in Ayurveda. Then inducing peristaltic movements. They can increase the peristaltic movements of the intestine to get the stool out of the gut, and also increase the water, actually not increase, actually they retain the water content in the stool, thereby depriving the body of the very essential nutrients and excess water which is required to be reabsorbed. But these purgatives or laxatives, they tend to make the stool soft and do not let the body reabsorb the water from the gut, and dependence on these laxatives makes gut sluggish. Actually, when you are putting somebody on laxatives like a ichabediras, like a, say sort of arham granule or a kayam tablet, these are OTC products. Uh, you are putting him on risk of dependence of the laxatives. They are these peristaltic movements which are induced by the laxative itself. They tend to decrease over a time, and if you stop this laxative, the gut movements will be so sluggish that the patient will constipate for days together, and you have to increase the dose of that drug again to get the patient defecate. So over a time, the gut doesn't respond to these drugs as well. So Ayurvedic laxatives can also cause dependence like other laxatives. So there's nothing different. If you are taking Ayurvedic laxatives on prescription by a trained Ayurvedic doctor, then the doctor knows better when to withdraw and when to decrease the quantity of the laxative, so that and put you on fiber, put you on dietary modifications and lifestyle modifications, so that you don't tend to get dependent on these drugs. So now we come to symptoms of laxative addiction. This is quite simple. First is dependence on addiction. Without that drug, he cannot go to the washroom and he cannot defecate. Electrolyte imbalance is very important. This can cause a lot of things, including dehydration, fatigue, nausea, vomiting, abdominal pain, cramps. This electrolyte balance tends to develop into other things as well. Sometimes this laxative, due to interference with the gut flora, these patients can develop chronic diarrhea, and sometimes due to frequent defecations, rectal bleeding can occur. Dehydration fatigue can occur due to electrolyte imbalance. Abdominal pain can occur, and it can damage the kidney as well due to this electrolyte imbalance. Diagnosis is pretty simple. The physical examination and the medical history of the patient can give you a good understanding why the patient is a laxative addict, and you can do stool test as well, some imaging tests, colonoscopy. You can go for sigmoidoscopy. A regular stool examination can help in some way or the other. You can also go for a thyroid profile of the patient, and we can actually diagnose a laxative addict by uh, questioning only, uh, which is called this parikshan in Ayurveda, like in Dashvit Pariksha and Trivit Pariksha. This questioning is included everywhere. So questioning is very important, and the medical history of the patient will give you an idea that this patient is allergic to addict. Now we'll come to the treatment of laxative addiction, mostly powered by Ayurveda. Detoxification, I have included three things here: Virechan, Vaman, and Basti. Actually, these three things will help to detoxify the gastrointestinal tract completely, and it will be like a new gut. If the patient is undergoing Purva Karma, Pradhan Karma, and Paschat Karma, Panch Karma, uh, Purva Karma, we can go for Snehan Sweden, and then in main Mukhya Karma, we can go for Virechan, Vaman, and Basti. Um, After that, what is important is post Panch Karma, that's Paschat Karma. In Paschat Karma, you have to be very precautious about selecting the diet. We'll come in the next slide how this works, Panchkarma, how it works. Psychotherapy and counseling is very important because most of the patients are who are laxative addicts. They tend to think that they cannot pass stool without a laxative. So counseling is very important. Then we have yoga like Pavan Muktasan, Vajrasan, Kapalbhati. Pavan Muktasan actually is very good for Anuloman procedures. You have the patient. You have to make the patient lie down on his back and ask him to put his these joints, knee joints, on the chest and pull towards the chest with his hands. Hold the breath for a while, maybe for 15 seconds, or if he can hold more, that's good. And then release again to repeat the procedure for 10 to 12 times. It's very good for patients with constipation. Vajrasan, this is the only asana in Ayurveda which can be done after having meals. So Vajrasan is very good in boosting the digestive fire. You can do Gomukhasana as well. Kapalbhati can be done early in the morning at Kapalbhati. You have to inhale deeply and then only exhale and till some perspiration occurs on your forehead. It's very good for to restore intestinal movements. Mild to moderate exercise. High or strenuous exercise is not recommended in Ayurveda for uh, inducing bowel movements or correcting the bowel movements. It's not recommended actually. And then we are going for this nutritional counseling and dietary advice. Nutritional counseling and dietary advice can be done. uh, Nutrition and dietary advice is very important. You have to tell the patient how to take fiber, when to take fiber, how to take fruit, when to take fruit, what should be the quantity of the fruit, and put him directly on dietary modifications. And uh, medication is not actually recommended, but in severe cases, medication has to be given. And we can establish support groups as well, where the patients and the doctors and paramedics can help each other. And in most severe cases, you can go for hospitalization as well. Prevention of laxative addiction, uh, until and unless a patient is prescribed laxative judiciously, actually. If it is not prescribed judiciously, unjudiciously prescription, because we as clinicians try to do more than what's required. We have to be very precautious in prescribing laxatives. We have to ask the patient to take a healthy and balanced diet with a lot of fiber in it. We have to ask the patient to stay hydrated, take a lot of fluid, and we have to tell him to go for mild to moderate exercise so that his gut movements are restored. Then we can advise him yoga asanas as mentioned earlier, Pavan Mukta, Sun Vajra, Sun Kapalbhati. There are a lot of asanas which can be done for this. Managing stress and anxiety is very important in managing irritable bowel uh, syndrome, and as well as the psychosocial conditions. Seeking treatment for underlying medical condition, if there is any underlying medical condition that can be diagnosed by using colonoscopy, sigmoidoscopy, and endoscopy as well. So that can be of help. And seeking help in eating disorders, this is most for a teenaging group, and uh, people who tend to take a lot of junk food and untimely food, uh, this unregularized food. Eating at right time is very important. So we come to conclusion. We'll discuss the conclusion in detail. Laxative addiction is a serious condition that can have long-term consequences on a person's health. If you or someone you know is struggling with laxative addiction, seek help from a healthcare provider or an addiction specialist. With the right treatment or support, recovery is possible. So, what my aim is like, this second point, that Ayurveda offers help by Panchkarma, which can do regeneration of the gut of the patient and proper post Panchkarma regime. Proper post Panchkarma regime shall help in boosting of the digestive fire, regrowth of the gut flora, restoration of the gut movement, and to help the patient with this laxative abuse. Uh, in brief, couple of minutes, I'll explain this Panchkarma procedure. For first of all, the patient needs to be admitted in inpatient department of an Ayurvedic hospital. Then you have to go for Purva Karma. Purva Karma, like Snehan and Sweden, which is must before going for any Pradhana Karma. Snehan Sweden you do. After Snehan Sweden, we can start with Vamana therapy. Vamana therapy will help in detoxification of gut above the level of the small intestines, actually from stomach upwards. So that detoxification of the upper GIT, and then we go for a virgin. Again, we can do Snehan Svedana for 3 days or more. Then we can go for Virechana therapy for lower GIT, small intestine and large intestine. And after completing the Virechana, we can put the patient on Paschat Karm for 7 days, and then we can go for Basti. Basti, Basti can be of three types: uh, Karma, Kal, Yog. Depending on the condition of the patient, you can select any one of that. The Basti can help in removal. Actually, in Ayurveda, we say that half of the Kaya Chikitsa is Basti. So Basti is very important to eliminate these Vataj rog. So Basti can be done, and after that, completing these three procedures is very important. And you can go for Nasya as well, and Shirodara, Shirobasti can be done to relieve the stress. And these shall help in restoration of gut flora. These shall help in restoration of this intestinal movements, and all other movements can be restored, and the patient can be brought back to life. This shall really help. And I would advocate that if a patient is suffering from drug abuse with laxatives, it's better to undergo a proper panchkarma therapy, and he shall be better. He shall be better without any other medication. References are given here. And thanks for your patience, and thanks for giving me the time. I wish you all the best, and uh, my good wishes to all of you. Thank you.